Every patient that we see is different. They will often come with similar symptoms, but actually it's only really by really digging down into what they're looking to achieve from having a plastic surgical procedure that we can really understand what it is that they're hoping to achieve by having the operation. And you can't really make assumptions about where people are coming from. So it's really important that we spend time with people and we view our outpatient appointments as a process rather than just a single episode of care for them. This will often mean people coming to see us on at least 2 occasions and sometimes more if either they or we feel that they might benefit from further exploration of what they're looking to achieve, but also so that we can be absolutely certain that what they're looking to achieve is something that we can realistically offer them so that there's not an unmet expectation at the end of surgery. As a minimum, we would ask patients to come see us for at least 2 pre-operative consultations. Now that's something that we have always done for our patients undergoing this type of surgery here. And interestingly, in the recently published standards by the Royal College of Surgeons for patients undergoing any form of plastic surgery, they have stipulated that they too feel that at least 2 consultations is the right way to do things so that patients have time to get the information from their initial consultation, to go away, to reflect on that, to discuss it with their friends or their family members, then to come back so that they and we can recheck their understanding of that initial information, make sure there's no further questions that they feel that need to be answered, or if there is, then to go through that with them. The second consultation is a bit more perhaps about the technical aspects of their surgery. We might focus a bit about, for example, if they're having an augmentation procedure, the size of the implants that they might realistically be able to use for that surgery. Or if they're having a breast reduction, explore perhaps what sort of size they might be thinking about possibly being able to achieve then, with the first consultation really being more about the procedure in general, about what they can realistically expect and more importantly not expect to occur as a result of having that operation. We always say to our patients that actually from a timescale point of view it's driven by them. They're under no obligation to proceed through to surgery having met with us, and it's always very important that they are aware that they're very much in control of this preoperative process. So if at any point they decide that either the operation isn't right for them or perhaps the timing of the operation isn't right for them, that we have no concerns about them voicing that and saying, actually, I'm going to put a brake on things now. We would much rather have a patient who makes an informed decision at a time that's right for them, rather than have a patient that feels they can't say, actually, I've had a chance to think about it and I want to put a brake on things. I qualified as a general surgeon, but with a subspecialist interest and training in oncoplastic and reconstructive breast surgery. And after 6.5 years of training, I was awarded a national fellowship, one of only 9 given out nationally each year, to go and work for a year in a plastic surgical unit up in Newcastle, where I worked exclusively with plastic surgeons, finishing off my reconstructive and my plastic surgical training in breast surgery. I've worked as part of the reconstruction team locally here in Bath, but also more regionally with the plastic surgeons in Bath doing joint cases for our patients. More recently, I've also undertaken a submission process putting forward supporting evidence to the Royal College of Surgeons, and I've been the first surgeon in the South West to accredit on their accredited register of cosmetic breast surgeons. We have quite a number of patients that come and see us here who have been to other clinics to discuss undergoing this type of surgery. And having met with people like myself and Michelle, who's the cosmetic nurse that I will always work in tandem with in the clinic, we think it's important that people get different aspects of support from different members of the team. A lot of them will comment on the fact that their experience with us is very different. So, for example, it's completely normal for them to meet me as potentially their surgeon on the very first consultation, whereas by going to some of the other clinics, sometimes they don't meet their surgeon until the day of their surgery. Now, I simply can't imagine how you can possibly understand what a patient wants to achieve from having an operation and how to go about planning that unless you've been involved in speaking to them preoperatively. So I think that's one big difference. I think Michelle, our specialist cosmetics nurse, is another very big difference. She's a fantastic point of contact for our patients, so they can speak to her both pre and post-operative about things if it's perhaps more convenient to just a few small questions where they don't want to come back to go through that in a formal clinic setting. So that's another real big difference. A lot of the patients looked after at the clinics won't have had that point of contact that they do with Michelle here. But another thing I've heard increasingly, particularly from our patients undergoing augmentation surgery, is that they are often told about what size implants they will be having as part of their surgery. Again, it's something that I don't understand, because when you go into this, what you're looking to do is work with the patient, hopefully to find a middle ground that you both feel that you can meet in terms of reasonable expectation and an appropriate outcome for that patient. And I had a patient in clinic just yesterday. He said to me, I've done this at Clinic X and I've done it with yourself and you just do it completely differently. And I really felt much more part of my decision making. So I think there are a number of things really. It all really centres around giving people the appropriate time and information and then the time to go and reflect on that beforehand. I think that's the thing that does really differentiate us from other clinics that offer this type of surgery.